Hi, everyone, to episode 15 of the Exoskeletons and Wearable Robotics podcast. We are very lucky to have today Dr. Zach Lerner, co-founder of Biomotum. And before we start, a quick word for our Patreon sponsors. We actually have, happy to report, 2 new Patreons. We have Stefano Tuxiri and also a new corporate sponsor in HeroWare. And special thanks to our VIP supporters, Volker Bartenbach, Rita Vasquez-Torres, Minmar, and our other corporate level sponsors, Humotech and Uxivo. So thank you all for the support. And we are very lucky to have Dr. Zach Lerner, a CSO Biomotum, Associate Professor of Mechanical Engineering, Researcher of Rehabilitation Robotics, and Director of the NAU Biomechatronics Laboratory. And also, Zach, I hear that you're a world-class climber and a member of the U.S. climbing team too?
I was many, many years ago, a lifetime ago. Yep. I would say, a quasi-professional rock climber, and I would travel around and do competitions, and it was the focus of my life for some time, but not so much anymore.
Was that the rope and belaying or bouldering?
Both. Yep, it was both. Yeah. And sometimes climbing, doing some deep water soloing, which is where you're on a cliff above the ocean. And when you fall, you land in the ocean.
Wow. Wow. I've never even seen this.
Yeah, it's exciting. Take a look.
That's pretty. I did some rock climbing in high school and then college, and then a little bit in grad school. We used to go to the Gunks in New York.
Oh yeah.
And so climbing there, but then of course, being an assistant professor, all of that has stopped, and then professor and everything else. But
yeah,
I didn't know that.
So how did you go from rock climbing to having your own exoskeleton company?
Well, so I've always been really interested in robotics. Growing up, I would, 25, 30 years ago, I was playing around with servo motors and building little robots in my room in middle school and high school. And so I've always been interested in that. I think becoming an engineer was a foregone conclusion. It's just how my brain works. And I knew I wanted to work as an engineer and work on impactful solutions to the problems facing our world. So for me, I have this love of physical activity and athletics, things like rock climbing and mountain biking. And I also have this love of robotics. So I was able to create a career that really combined the two. So creating robots that help people move, and in particular, people that aren't as lucky as I am in terms of how my body works. So I've been really interested in designing wearable robots that help people that have difficulties moving, people with disabilities, and that's how I got into this work. I've been designing wearable robots for over a decade now, and I co-founded Biomotum with our CEO, Ray Browning. This was in 2019, so 5 or 6 years ago, and we're working to commercialize a powered ankle exoskeleton. One of the primary targets is to use the device for children with movement disorders, so like cerebral palsy. And the device is active. It can provide powered plantar flexor assistance, so to help during the push-off phase of walking, for the purpose of improving mobility, making walking easier. But the device also has integrated biofeedback and can be used as a resistive training tool. And so in that capacity, the device would be used to strengthen the muscles, improve muscle recruitment, and it would be a tool that they wouldn't wear it all the time, but they would use it for at-home physical therapy, for example.
So how did you get into pediatric, robotics? Because I think we wanted to focus a little bit today on understanding exoskeletons for children, because there's not many people that do it, and you are one of the experts in doing that. So how did you kind of get into working with children?
Yeah, so it started in grad school. I worked on some projects related to pediatric or childhood obesity. And at the time, we were using computer modeling to understand the impact of pediatric obesity on the growing musculoskeletal system. And, I thought it was fantastic working with kids of all body shapes and sizes. Kids are just inherently positive and full of energy, and they're a pleasure to work with. In contrast, some older adults might not be as excited to come to a research lab and try out new technology. So that was kind of my initial foray into pediatrics. And then when I was a postdoc, I did my postdoc at the National Institutes of Health with Dr. Tom Beulah and Diane Damiano. And they have a really great lab there. And they were working on a pediatric knee exoskeleton. And I came in and assisted with that project. And we created an exoskeleton to alleviate crouch gait. So crouch gait is a walking pattern that's characterized by excessive knee flexion. So the body is kind of in a crouched posture, as the name implies, while you're walking around. And it's a really metabolically demanding way to walk. You can imagine the quadricep muscles are active throughout the gait cycle, and it's really laborious. And so we were trying to alleviate crouch gait. And from there, we had a successful project, and the kids responded really well. And so when I had the opportunity to start as an assistant professor, I knew I wanted to keep working with kids. They're a pleasure to work with. And not only are they just genuinely curious in coming into a biomechanics facility and being a research subject, but they're also curious with robots. And I think kids have an easier time with technology adoption for kind of, I think they could be early adopters.
Sure.
If you contrast that with an 85-year-old who's just suffered a stroke, they might not be interested in having this Bluetooth connected powered exoskeleton. They might not be as trusting of it, but kids, they're up for anything. And they're also growing up in a time of Iron Man cartoons and human augmentation. And so we like to describe what we're doing as similar to that. We're really trying to augment the body, and it doesn't matter what type of body it is. And kids seem to respond pretty well to that.
Strikes me how multidisciplinary the exoskeleton industry is, because here you need to be an expert in biomechanics, physical rehabilitation, robotics, electronics, mechanics, mechatronics, and on top of that, you're touching on sociology, anthropology, looking at the adoption and how the device would be used as well. So it always, every time we have these conversations, that's like the first thing that comes to my head. It's like, this is so multidisciplinary. And we're not even touching upon that. We are talking about the viscoelastic materials, and you don't have one-to-one transfer of energy and motion because the body is a soft, mostly it's like almost a jelly semi-liquid state. So which adds another level of engineering complexity.
That's right. And Bobby, I think you missed an important discipline, or a kind of related discipline, and that is psychology. So how we communicate with our research participants is really important. Depending on that interaction, you may have a favorable outcome in the study or an unfavorable outcome just because a child feels comfortable or uncomfortable or safe or not safe. The psychological environment is really important. And that's something that took us some time to learn. And there's also the psychology of incentivizing. How do you incentivize a 5-year-old to walk on a treadmill for half an hour while they're wearing, a scary face mask, and it makes it a little bit more constricting to breathe, and thinking about like rewarding their behavior to kind of get them to be able to complete the protocol. Now, these are all things that took some time to figure out.
It's really fascinating, and we hear almost the same thing from the occupational and military side of exoskeletons as well. And that is why I'm so determined to keep Exoskeleton Report, have medical, occupational, military, and consumer research and first responder exoskeletons all in one place, because the challenges and the approaches and the lessons learned transfer and are so similar from one application to another. So you wanted to ask?
Yeah, I was going to ask, so who are some of the type of, like, in your lab, like you're going to do a research protocol with a 5-year-old, who are some of the type of people in your lab? Like, I'm envisioning that you maybe have some people from kinesiology or some people from physical therapy, because I know there's a really good physical therapy up at NAU. And I'm thinking, again, robotics people. So can you comment on like, how do you make sure that the protocol is successful? Like who is, how do you form a great team? I guess.
Yeah, that's such a good question, Tom, and something that is really easy to overlook. So typically, you might say, okay, we have this new exoskeleton. I have a really talented mechanical engineering PhD student who's working on it, or maybe a postdoc in an engineering discipline. And these are folks that have never really interacted with a kid outside of their family, and they might really struggle to connect with the child. And they're also super focused on the technology. They want to make sure the sensors are responding properly, the device isn't breaking, that's safe to use. So something that we learned really quickly is we need to have someone in the room with the research participant, and their sole job is to interact with the participant and make them feel comfortable, make them feel heard, give them updates. So kind of like read the mind of the engineer and say, okay, so right now we have Mike or whoever, he's fixing the exoskeleton and it'll be ready in a couple of minutes. So just like for the sole purpose of interacting with the kids. And you're right, we have a great physical therapy program. It happens to be in the building over from our lab. And we collaborate with pediatric physical therapists who know the language, they know how to interact, and we have them in the room. So sometimes when we're fortunate enough to have them in the room, they serve the role of this kind of interaction specialist, if you will. And over time, those are things that you can pick up. And so we've trained our research group to interact appropriately with our research participants. And so there's some institutional knowledge that we have. I also find that matching the gender can be really helpful. So having a young girl interacting with a female student can be a little bit easier than having a young girl interacting with a male student. And so we try and match the gender, because there are things that there can be differences in how these individuals interact or how comfortable they may feel. And it's a learning process. I don't want to come off as being some expert here, but we think intentionally about our research participants, because we know that it's really easy to lose their trust. And if at the end of the day, if they're not interested in engaging in this demanding protocol, then we won't be able to do the research and we won't be able to kind of progress in our mission.
Could you talk about maybe some success stories you think you had? Like, I know I've seen some talks by in some of the work you've done, but just for the audience, some success stories like, so-and-so can walk 100 feet, but if I put on this device, I can walk, for 30 minutes, or, you're never going to be perfect and things like that. But I don't know. I'm just thinking about what are some success stories that you're pretty proud of over the last 10 years?
Yeah, there are a lot, and I think it'll be fun to reflect on them. One of the most impactful and memorable things that I can recall is we were doing our first ankle resistance study. So this is where the device is actually making it harder to plantar flex, and we're really recruiting the calf muscles. So that we're trying to increase the muscle activity of the calf muscles during push-off. And we started a training study where our participants would come in about 3 times a week for 4 weeks. And at the end of this training protocol, I can't remember, I think the physical therapist actually came with the research participant for a follow-up assessment. So I remember having a face-to-face conversation, and they're like, what have you been doing? Like, what have you been doing in this research study? It's almost unbelievable how much improvement I've seen with my patient. Speaking in the voice of the physical therapist. And so that's where I was like, oh, I think we're really onto something. If the physical therapist is noticing an improvement, then there might be something here.
Yeah.
And that's one really memorable example of I think some progress that we've been making. And it's one of the challenges with our line of work, and I think with exoskeletons in general, is that there will always be a variety of responses. You'll have some kind of super responders and then some non-responders. and acknowledging that you may have a study where you show no group level difference, but there are participants in that study that greatly improved. I think it's something that's worth mentioning, because as an academic, it's hard to know how to present the results of a study when on the whole it's kind of a neutral outcome. I think it's important to note that you may still truly have groundbreaking technology, but maybe the inclusion criteria of the study was too broad, or there are just some other factors that happen. Challenges with human subjects research related to a child being sick or injured, or there's so many factors that could go into these things. And so I just wanted to make a quick little plug that even so, if you're an academic researcher, you're performing a study and there's no large improvement, it doesn't mean that you need to abandon course. It becomes a little bit more tedious to describe the outcomes of that study.
Yeah, I know. We've always, I've seen this. We call them super users. Some people, they just get into the exoskeleton and they can ride it and use it, and like boom. Like some people, they get on a bike and Bobby and I have talked about this, where it's going to take time for people to understand and how to use these things, right? Because some people, they get on a bike and man, they do it, and some people, they never learn to ride a bike really well, right? That's just the way it is. And it's tough, because I've had this where you have 2 or 3 people and they're in a powered prosthetic ankle, the stuff I was doing, and they're there's just absolutely fantastic, one-off stories, right?
Mhm.
But you go to write the journal paper and your journal paper gets rejected because they're saying, I don't want a onesie, twosies journal paper. Give me a group study, and 8's not good enough anymore. Now I want 12, a minimum of 12 subjects or 12 participants. And then it's hard to show group, improvement and that kind of thing. So that's an interesting,
Yeah.
for our
Yeah, it's a challenge for us,
challenge. Yep.
especially as we do kind of longer protocols, and both in like the number of visits and then the amount of activity within a visit. You asked about kind of some things that I've been proud of over the past 10 years in some of our development, and I wanted to quickly share about some work that we've done really to bring the exoskeleton outside of the lab. And so for those of you who aren't familiar with the ankle exoskeleton that we've been working on, it's relatively simple, and the control strategy is really simple. And I'll just say that that's purposeful. We've tried to create a really simple device that's intuitive to use, and something that we know works 100% of the time. Something that we've seen is that it's really easy to lose the trust of the person who's wearing the exoskeleton. And when you lose the trust, you kind of go backwards in time in terms of the acclimation that's needed to see any benefit from it. And so we purposefully have been working on a simple device with a simple adaptive control strategy, because we wanted to make it practical for people to use, and in particular, practical for them to use outside of the lab. And in the last couple of years, we've had the opportunity to do controlled experiments outside the lab, so on real world terrain across different kind of walking durations, and had really great success there. And then we did a pilot study where we sent the device home with people to use for a week in their own community. So we worked with them to map out a walking route near their house, it could be around the block or to the park and back. And this was a small number of participants, only 5, because it was pretty logistically challenging. But we saw really great outcomes, not only in terms of improved speed, so the improved performance, but also in the attitude towards it. This patient population was individuals with cerebral palsy, and we found that by and large they enjoyed walking more with the device, and so that was really encouraging. And something that we've started to focus on more, which is the perception of the device, because ultimately it's the user's perception that would result in them wanting to use the technology or not. It's not their metabolic cost of transport. It's not the change in their muscle activity. It's how it makes them feel. So there's a bit of a disconnect between the research community and the journals that want these empirical kind of metrics, which are incredibly important. And I'm right there supporting that. But there's a disconnect between those metrics and then ultimately what will drive adoption, which is purely based on how people perceive the device and how it makes them feel. Because if they feel like they can walk longer, they have better endurance, it makes them feel stronger. And those are the types of feelings that will make sure the device doesn't end up in the closet and, never leaving.
Right.
And real quick for our listeners, I want to emphasize that even though right now we're talking about medical exoskeletons, we're hearing exactly the same stories from every single other exoskeleton application. That if you have a group of 10 people, there could be 2 or 3 that have a difficult time adapting to it. That the psychology, the trust is important, and that you have this. I think you put it extremely well. I've never heard actually anyone put it so elegantly. This divide, this chasm between hard metrics, measurable hard metrics, and perception and adoption. I'm so happy that you're touching upon these topics because they priority one the relevance to the entire exoskeleton industry.
Yeah, I wanted to put some time into this word adoption because the reason I want to is, we started the Wearable Robotics Association, I think, what was it, Bobby, 2015-ish or something? I have to go back and think. And Bobby and I both been at this for over 10 years and there's the whole community. I mean, there's communities, been at this for more than 20 years, with the exoskeleton work in the military, long time. And then the exoskeleton work that, I started doing hand mentors and foot mentors for stroke back in 2005. So I know how hard it is to work with stroke survivors, excuse me. And so, but this word adoption. And so how do we, when I challenge the question and we challenge us all, how do we see better adoption? What do you think, and focus it on your area, how do we get to people will wear an exoskeleton to school, right? And how do we get there, do you think?
Yeah, it's a great question. I'm not sure we'll kind of come to a concrete answer now, but a few things come to mind. And the first thing that comes to mind is paying really close attention to the user experience. And so this is so zooming out a little bit, it's the entire experience of using the device. And maybe even beyond that, it's, how expensive the device is, how accessible it is. And then, looking at the reliability and then the interaction with the device. Something that we have a lot of conversations about relate to noise and battery life and form factor. So those aspects are in addition to whether or not the technology works. And 5 years ago, I was really naive in thinking that if we have an exoskeleton that works, then it deserves to be a product and that people will buy it. But it turns out that I think that's such a small part of it in actuality. And it's this broader experience with the technology that's much more important. So whether or not the device fits under someone's clothes, can it be used with any pair of shoes? If we're talking about kids, is a child going to be embarrassed by it? Will it last all day on a single battery charge, or do you need to have backup batteries and a charger at school? I think in general, people want a device that is largely invisible. And this is speaking specific to maybe mobility augmenting devices that would be used every day to make walking easier. Something that we did this last summer, I have a really talented PhD student, Emanuela, who led an I-Core project. So this is the NSF I-Core project where you have to interview 100 users or stakeholders within a short amount of time. It's within a month or something. It's a tremendous amount of effort. And we really wanted to understand in a pediatric space what the perceptions were around exoskeletons used for augmenting mobility and exoskeletons used for at-home training. And we learned, to our surprise, that most people just wanted a device to make their lives easier. They weren't really interested in a device that could replace a physical therapist that they would use for training. And some, to be fair to all of our responses, some people did see a potential there, but just kind of generalizing, most people, and I identify with this too, they just want their lives to be easier and to be better. And so I kind of reinvigorated, like, oh, okay, yeah, there's this space for assistive exoskeletons that could be used for children to keep up with their friends at school, or to keep up with the family as they're walking the dog, or whatever it is. So I do see some potential here. And then, around this question of adoption, it's all the little things, how the device looks, how it sounds, how long the battery lasts. And then, of course, does it work, and how does it make people feel?
Yeah,
Wow.
that was fantastic. And what I'm thinking about too is the one challenge I was thinking about is like everyone wants, because I had this with my powered ankle that we had done with a lot of people, is everyone wants it to be invisible. And I have two thoughts on that. One is like it's so hard to be invisible because you've heard me say this too. It's like people don't realize like you've got like thousands of pounds of pull force on these devices, and 200 watts for walking, 1,000 watts for running, and we were doing similar work. And it's like I can't make it invisible because you don't realize how darn good the Achilles tendon is, and the calf muscle and the body is. So I was thinking that in my head, like I can't make it invisible. And then also what I was thinking in my head was, I think 20 years ago, people wanted it to be absolutely invisible. I don't want to show anything, but I thought over the last 10 years, working with some military veterans, like they were willing to show off their like robotic device, right? Like, hey, look, I got a titanium robot and this thing is cool. And, like the younger generation, I think, is willing to talk about it more, show it off. Maybe I'm even going to use a weird word, like maybe it's transhumanism is not so weird anymore, right? Like we're willing to do VR, AR, on the web for, I'll just, that kind of thing. So anyway, I don't know, does that bring up any thoughts? Like one, how the heck do I ever make this thing invisible? And then two, maybe people are willing to show their cool device off to their classmates,
Yeah, I think you're absolutely right in that we're shifting towards more acceptability. And as an engineer, I love the idea of us exoskeleton engineers not needing to make devices invisible, because it's an impossible task. But if we can just shift the narrative, and if there's better cultural acceptance. Someone recently mentioned, I think at the Golden Globes this last week or two, there was a plug from one of the awardees about better representation of different bodies and disabilities on screen. So, I think that needs to happen. And in time, it will happen. And as it happens, then people will show off their really great exoskeleton technology.
Yeah, that was the Winter Soldier actor. Right now, I can't remember his name, unfortunately.
Same, yeah.
I don't watch too much TV, but back to like some successors. I was just thinking out loud, because I've seen some of your talks where, like someone is walking over ground at NAU, going up and down hilly terrain with an exoskeleton device. And, could you say like, hey, they could only do this loop once without a device, but they could do the loop 5 times with the device. I guess what I'm kind of thinking of for our community, like what would, like I'm a parent and I've got a child with CP, where do I, where are some success stories, or where do I see some things happening over the next 5 years? Where do you want to, push? Where are you pushing?
Yeah. So we have had a lot of successes, and something that I've noticed is that there's a particular profile of our research participants that really suggests that they'll be, we'll call it the super user. So acknowledging that exoskeletons for kids, it's not for every kid, and it's going to work better in some kids and maybe less well in other kids. We're getting really good at figuring out, okay, who it's going to work for very well. And, it's the child that has mild to moderate crouch gait. They initially have, a pretty slow walking speed. So there's a huge room for improvement. There are some kids with CP who are, their walking disability is not very visible. It's less pronounced. And an exoskeleton may do more harm than good for them. But there's this range of walking ability that we've identified that seems to be really kind of prime for improvement. And when we do some of our outdoor kind of real world terrain studies, we're seeing 30-40% improvements in speed and improvements in energy cost, and in this particular group.
Mhm.
So it's whenever I see it, it's super motivating for us to keep developing the technology. And that's what motivated me in large part to co-found Biomotum, our spin-off company, because I truly believe that our technology can improve the lives of many, many people. But just doing the research in the lab, it's never going to be, it can be impactful and scientifically, but there's a way to make it much more impactful for humanity overall. And I think that's to create a company that can provide these devices to people. So that's these success stories have led to our desire to commercialize, and not for the purpose of making money, but for the purpose of distributing the technology to the people that can really benefit from it. And of course, you have to have a sustainable business. Like, that you have to be able to afford sales and support team. Those are just realities of being able of running a successful business. I'm not the expert there.
I mean,
but
law teams, marketing,
yeah.
law, business, everything I saw, all that kind of stuff. But where do you see the Biomotum device? Where's your first win? Is the first win going to be in the clinics, or is the first win going to be a take-home device, or both? Or, and I don't, but I'm just
Yeah.
interested.
Great question. We have this conversation a lot, and it stems in large part from the path of least resistance in terms of the regulatory hurdles.
Yeah.
So we think that having a device cleared for use in clinic will be easier to have cleared through the FDA than a device that would go straight to the home. And so it's likely that our device will land in the physical therapy clinic first, and then we'll end up as a personal use device for use at home and in the community. But that's really where the device belongs. The device belongs with people to use every day, however they see fit.
Yeah.
And so we're trying to get there as quickly and efficiently as possible.
That's tough. I joke around with people. This guy, you've met him, Kevin Hollander. We've joked around where, like, I've won many NIH grants to build devices for the clinic, and we do the scientific studies. But every time I've written a grant to say that we'll do it, it'll be a take-home device, I've never, maybe I hope you have, but I have never won a scientific grant for a take-home medical exoskeleton device. And we've done work in elbow exoskeletons for brachial plexus surgery. We've done work in, powered prosthetic ankles. We had work in orthotic devices. We had Rupert. It was a feeding device, for reach feed for stroke survivors. It's just interesting. So I just, have you ever won a grant on a take-home device?
Not so.
Anyway, you don't have to.
Yeah. I think this, if you're an academic researcher listening, you may appreciate this. So I was really fortunate to receive an NIH R01 related to using the device in clinic, and we partnered with really great investigators at Gillette Children's Specialty Healthcare, Mike Schwartz in particular. And then the next grant that I wrote, this was a year after getting my first R01 awarded. I'm kind of on cloud nine from the sense of feeling really accomplished. And I wrote a grant that spoke to testing the technology at home. And that grant wasn't discussed And so if you're familiar with the NIH grant review process, it's like the top 50% of the proposals are discussed in the scientific review meeting, and the bottom 50% aren't discussed. And so I had never had a grant that scored in the not discussed range. And so it was a good, like, I was taken down a few pegs.
Yeah.
But I will say, since then, we were fortunate to receive a Blueprint MedTech grant. So this is a program out of the NIH specific for commercializing kind of neurotech. And we described a home use application and device for our ankle exoskeleton, and that was successful. But I haven't had success in the traditional, like the R grant at NIH.
Yeah, those are R21s and R1s. For the community, the R01 is the premier of the premier. It's like a 5-year, phenomenal grant. It sets you apart to get an R01. I've had NIH SBIR phase 1s and phase 2s. I've had some DARPA grants, but I must say to the community, I actually never had an R01 yet. I've had some very large grants, but congratulations on the the R01 is where you're at the top of the community. So congratulations on that.
Congratulations, Vinod, indeed. Yeah, before we run out of time, I'm dying to ask you, you said many people can be impacted by this technology. Can you run us through some guesstimated numbers? So starting with ankle cerebral palsy, like in Canada, USA, are we talking about 10 kids that could benefit from this? 100, 1,000, 10,000? What is the order of magnitude?
Yeah, so I certainly hope it's more than tens and hundreds. It's certainly in the thousands, without a doubt. So if I would estimate that there's probably, there's at least 1 million kids and adolescents that have challenges with walking that the technology could benefit. So the challenge is that from the medical device investor, those are pediatrics. It's a really small population, like 500,000 or 1 million. Like those are really small numbers. But one thing that we try and remind investors and try and remind our audiences when we're talking is when you're working with kids, you have the opportunity to change the entire trajectory of their life. And if you're successful, you have the opportunity to work with this individual across their lifespan. It's much different than working with someone at the end of their lifespan, where they might use, best case scenario, they might use one device for a couple of years and see improvement, or maybe they're 95 and their time has come. So working with kids, the overall, the number is relatively low, but the disability years that you're treating is quite high. So compare that with, there are at least 10 times more people that are stroke survivors. But you look at these individuals, and the average age of someone surviving a stroke, I'm going to guess, is somewhere near 75 or 80. I don't know, but it's this end of the lifespan, or it's a spectrum there. That being said, I think our technology and ankle exoskeletons in general have the great potential to work across the lifespan. And we've done some studies in older adults, so treating sarcopenia or age-related decline in muscle function. We've done both assistance and resistance and saw great success there. We've worked with people that have had strokes, Parkinson's disease, spinal cord injury. So while our focus is in pediatrics, we see a potential for ankle exoskeletons across the lifespan. And our hope is to really create a technology that's useful for many different people.
Yeah, so long term, you can take this initial application and then expand it, from what I'm hearing, to foot drop, people that have cardiovascular difficulties and they can put a strain on their heart, but they still want to be mobile. So this way, like a possible future variation of your device, I'm assuming could be altered to do that, take all the energy from the batteries and offset any possible heart rate elevations and so on and so on. So would you say that at the end of the day, do you have any numbers on how many people in general end up in their lifetime with some sort of difficulties in the ankles. Would that be now in the billions of people?
Yeah, so we had the opportunity as a company to participate at the Consumer Electronics Show, CES, in Las Vegas, and we were a part of the AARP Age Tech Collaborative. And so our work in older adults is very preliminary, but we as a company and others see huge potential for this type of technology to work with older adults. And this is kind of a growing emphasis in many different fields and disciplines and areas of our society as our population starts to age. And yeah, so huge potential there.
Yeah, I agree. I've been working in some areas for mobility. I've been working with a company, Life Glider, and thinking about how to help people in independent living, that assisted living and things like that. So I had a father that was aging, and so we looked at independent and assisted living, and there's a lot of need where you're in these places and you want to still be able to walk around, go down for dinner, eat, go walk around the park area and things like that, right? Because if you're just staying in a I'm going to call it a dorm room. If you're just staying in a dorm room and then you're just there, it's pretty depressing. You know what I mean? You want to just get out there and at least walk, 3 days a week or something like that. So I know that's quite important.
Yeah, there's so many benefits of walking, physical activity, and changing your environment like that. So yeah, I hope that all mobility related exoskeleton technology promotes that. And this is kind of speaking back to the beginning of the podcast, as an active kind of outdoor lifestyle enthusiast myself, there's a whole community of people that could really benefit from technology that gets them out in nature.
Gets them out walking and things. I mean, walking is just so important. Any last thing? I'm just thinking, any last things that, maybe we didn't ask, or maybe there's some burning thoughts in your head, like, oh, I really wanted to talk about this, or any thoughts, Zach?
Yeah, so there's a few things that we're excited about in the research lab. One of these things is related to the entire kind of user experience of exoskeletons, and in particular, battery life. So we're working on innovations to combine our active elements, so our battery-powered actuators, with spring elements to improve the storage and return of elastic energy. So that way, the same battery capacity will produce 30 or 50% more powered steps. But these are things that we think are going to be really important to facilitate adoption in the real world.
Yep.
And the last little plug and thing that we're really excited about is related to a comment that Bobby mentioned around how challenging it is to develop exoskeletons because of the wide variety of disciplinary specific knowledge that is required. So electrical engineering, mechanical engineering, computer science, controls, material science, then there's the clinical aspects. And so something that we've been working on and are excited to release in the not so distant future is an open source exoskeleton platform that's purposefully designed to be accessible. And by accessible, I mean, it could be used by a mechanical engineer who doesn't have a deep background in electrical or writing computer code. So we've purposefully created a system that's simple, it's modular, and it's accessible. And it's based off of a kind of a modular electrical hardware system that can interface with a variety of different motors. And so you can kind of pick and choose which actuators and which joints you would want to assist, like the hip joint, the ankle joint, or the elbow joint. Those are a few of kind of our case study examples. And so to address this challenge of needing a kind of broad skill set to accelerate exoskeleton development, we're hopeful this will be a powerful tool for the community. So this work is not yet publicly released and published, but it's something to be on the lookout for over the next coming months.
Yeah, please keep us posted, because we already added that type of category of exoskeleton devices on the Exoskeleton Report catalog, which at Exoskeleton specifically as a research tool. So this will fit like 100% perfectly. And thanks for mentioning that combination of powered and passive combined exo, because we're seeing that now as an industry trend where this whole divide of passive active is merging back together into one, where we're seeing now more and more exoskeleton devices take advantage of the advantages of both. So they have a combination, not so much a quasi-passive device, but more like a semi-active. So I'm really happy to hear that. Yes, that I'm not imagining that really is an industry trend.
Yeah, I imagine there will be fully active devices, but that use clever passive elements to offload motors and offload batteries to extend usage and also device durability.
Yeah, if you don't mind me doing a plug, but I was going to say, Zach, maybe the two of us, if you ever need me to be a co-PI, I don't need to be PI, but ever need me to be a co-PI on a grant sometime, I'd love to do it. In the sense of that was our robotic tendon, where we didn't get a lot of publicity at the time, but by us putting that spring in series at the ankle, we were able to cut the peak power of the motor from 250 watts down to about 30 to 40 watts. And then we weren't turning the motor backwards under load because we let the spring do that. And so that's the part I think people never realized, was that we kept on moving the motor in the same direction the entire time of the ankle gait cycle. And so we never reversed direction under load to save the durability of the motor and the power and things like that. So I think it's really important work, I guess, on the getting devices out there for people to use. If you don't mind, I'm going to mention a couple, like I'm thinking out loud, Bobby. Oxivo is putting out some devices, if I say that name right, devices for education. Am I correct, Bobby? Or correct me on that. And then Humatech has some devices out there, for people as well. So I think this is an important area and an important market.
Yeah, and the full list, we have a full list on the Exoskeleton Report, because there's like a hang version, which is purely a research one as well, in addition to the clinical one. And then there's a few others that I can't really name off the top of my head right now.
Any last thoughts, Zach?
No, I just want to acknowledge all the great work that you've done, Tom. And, we're very much building on the foundation that you and others like you have laid for us as the newer generation of academics. And yeah, I'd love to collaborate with you on some future work. So let's get in touch outside of the podcast.
Bobby, why don't you end it? I think you always end it well.
Yeah, thank you everyone for listening. I think this was a phenomenal episode, which touched upon medical, pediatric, but all of the themes apply to the wider adoption, design, and creation of exoskeletons. Thank you so much, Zach, for your time. Special thanks to George Woodland for helping us run the podcast and the background, compiling the bios and introductions. We wouldn't be making these episodes without his help. And please support us on Patreon, check out our newsletter, visit the website, and help us not jumpstart. This is a pretty active community, but get more investments, get more people talking, get the wheels spinning just a little bit faster.
Thank you.
Thanks so much for having me. Great time. Thank you.
It was a pleasure. Thank you.